Watching my child struggle every day with autism was heart-wrenching. I tried therapies, interventions, and countless specialists, but I kept wondering, is there more we can do? One evening, I came across stories about families traveling to Tijuana for autism stem cell therapy. I was skeptical. Could this actually help? And how would I even know which clinics were safe?
Stem cells are opening new doors in the supportive care of autism. Regenerative medicine offers new hope for supporting neurological development in individuals with autism spectrum disorder. Mesenchymal stem cells have shown potential benefits such as reducing neuroinflammation, enhancing neural connectivity, supporting cognitive and language functions, decreasing repetitive behaviors and irritability. At CellsTime, we apply safe and personalized protocols designed to improve each patient's quality of life.
PlacidWay. Through their platform, I could see verified clinics, read real patient reviews, and ask questions about the procedure, all from home. They connected me to specialists and explained what to realistically expect. For the first time, it felt like we had a path forward, a way to explore possibilities safely and informed. I knew this journey would be challenging, but with guidance from PlacidWay, I felt confident taking the first step. I started by browsing online, reading everything I could about autism stem cell therapy. Some stories were inspiring, others confusing or outright alarming. I realized I needed guidance to separate fact from hype. PlacidWay made that process clear. I submitted my inquiry, describing my child's condition and our goals. Within hours, a coordinator explained which Tijuana clinics specialized in pediatric stem cell therapy for autism. They explained what stem cell types they used and what outcomes we could realistically expect. They also helped us understand logistics, travel, accommodations, costs, and timelines. Most importantly, they emphasized safety and clinic accreditation. I finally felt like someone had my back, helping me navigate this complex medical tourism landscape without blind risks. By the end of that process, we had a plan, a timeline, and a clinic we could trust, something that would have been impossible to figure out on our own. When we arrived in Tijuana, everything PlacidWay had prepared was already in place. Our medical records were ready, consultations were scheduled, and the clinic staff knew our needs. During the first consultation, the doctors explained the therapy in simple terms. Stem cells could potentially help improve brain function and reduce some behavioral challenges associated with autism. They were careful to set expectations. It wasn't a miracle cure, but some families saw improvements in communication, social interactions, and focus. Walking through the clinic, I noticed other families in the same journey. PlacidWay had matched us with a reputable clinic, so I felt confident that we were in a safe, professional environment. The guidance they provided beforehand meant we could focus on supporting our child rather than worrying about logistics or credibility. The therapy process was careful and structured. Our child's stem cells were collected and prepared under strict protocols, then administered according to personalized treatment plans. PlacidWay had ensured the clinic followed safety standards and pediatric guidelines. Over the next few days, the staff explained what changes to watch for: behavioral, cognitive, and physical changes. They also provided support strategies for home use. While results vary for each child, the team emphasized improvements often happen gradually, sometimes over months. Thanks to PlacidWay, we were prepared for every step. They explained the types of stem cells used, the mechanisms behind how they could influence neural pathways, and what realistic improvements might look like. We were also given guidance for follow-up care once we returned home, including therapy adjustments and progress monitoring. By the end of our visit, I felt empowered. We weren't chasing a miracle. We were taking an informed, carefully guided step to support our child's development with professional oversight. Stem cell therapy for autism is still experimental. PlacidWay made sure we understood the risks, potential side effects, variability in outcomes, and the need for ongoing care. Not every child sees major changes, and results can differ widely. One thing became clear: choosing a reputable clinic is critical. PlacidWay's vetting process helped us avoid unregulated providers or unrealistic promises. They also educated us on ethical considerations, proper protocols, and what to ask before any procedure. This guidance made a huge difference. I realized the therapy wasn't a guaranteed solution. It was a possibility, but one backed by expert support, safety measures, and careful planning. Without a trusted guide, navigating this journey would have been overwhelming and potentially risky. If this video helped you understand the journey, like and subscribe for more honest insights into medical tourism and treatment options abroad.